Hi, my name is Dr. Celedonia Yue. I'm a family physician in Tahunga, California. And I decided to do this coaching certification in eating psychology because I feel that so many of my patients in my practice with so many symptoms have an issue with diet and nutrition and the relationship to food. So for my final project, I wanted to do something kind of fun and creative and something that would give me some information about the community that I work with. What I did was I fashioned a questionnaire. It's made of 30 questions, and I want to just read you what I wrote. I handed this out to 100 random patients that I saw in the last month or so. Dear patient, I'm inviting you to participate in a special project I am working on. This year, I am completing a coaching certification program in eating psychology. I am also embarking on a special mentoring program for visionary physicians who want to be the change in our current healthcare system. If you would like to be a part of this process, please answer the following questions to the best of your ability. There are no right or wrong answers. The goal of this questionnaire is for me to understand how patients in this community think about their health with an emphasis on their relationship to food. So what I did was I grouped questions together. The first group of questions asks about things like physical health, mental health, financial stability, environment, degree of creative outlet, sexuality, spirituality, life purpose, and presence of healthy relationships. And I asked patients to rank those on a scale of 1 to 10. Next, I asked about stress and happiness. I wanted to know if they thought they needed to lose weight. I asked them about how often they diet. And then I asked about a few toxic dietary beliefs, such as the best way to lose weight is to eat less and exercise more. Dietary fat is bad for my body. I wanted to know how many people tended to overeat, how many people binge eat. I wanted to know if they were fast, moderate, or slow eaters, how often they exercised. Do they feel fatigued much of the time? Do they have digestive problems? Do they get sick more often than normal? Do they feel depressed? And do they worry a lot? So this was sort of the range of questions that I used. And what I did was I asked on all of these questions, or most of these questions, to rank it on a scale of 1 to 10. I tallied up the results and figured out an average, and I sort of looked for trends to see if certain questions, they were highly on the high side or highly on the low side. So I just want to summarize my results in a few minutes, and to, at the end, let you know what kind of my action plan is, like what I learned from this and what I plan to implement in my practice from learning from this. Okay, so the ages range from 18 to 80 years old. I decided to eliminate the pediatric population, and I also eliminated patients on the high end who were either demented or had so many multiple medical problems that it would be really hard for them to finish the questionnaire. Gender-wise, 27% were male, 73% were female. And I feel that this is because my practice, half of my practice is a traditional managed care, normal family practice. And the other half of my practice is a cosmetic practice. I do Botox, filler, laser work, and that population is heavily female. So this combination of patients was all included. I feel like about 2/3 of the patients that answered the survey were either were actually medical. There was a smaller percentage that were only spa, and there was a certain number, a good number, that were overlap of both. There were a few people that were actually not patients but live in the community, and the reason why they answered the questionnaire was because the patients that got the questionnaire were so excited that they wanted their friends to do it, and I accepted those as well. Okay, so in terms of physical health, mental health, financial stability, environment, degree of creative outlet, sexuality, spirituality, life purpose, and presence of healthy relationships, I was actually surprised that the score was actually quite high. The average scores range from 6.84 to 8.28, and the lowest scoring was relationships. And I feel like that is reflective of what I actually see in practice. When I do ask patients and explore about what is bothering them, I think the most common thing that I find problematic for people is a lack of connection to other human beings, a loneliness, and a lack of healthy relationships. So I do feel that that scored a little bit lower, and that actually seems to be what I actually see in practice. Stress levels. 28% of people rated stress 10 out of 10. That's pretty high. And interestingly, 29%, almost the same percentage of people, rated happiness a 10 out of 10. One thing I'd like to do is to go back to the questionnaires and actually look to see, okay, the people who rated stress super high, did they rate happiness really low, or what? 53% of people felt very strongly that they needed to lose weight, and 73% of people were often dieting. In terms of toxic dietary beliefs, 70% of people still believe that the best way to lose weight is to eat less and exercise more. 61% of people felt that dietary fat is bad for their body. Interestingly, 52% do not think they overeat. They rated it super low. 52% rated it a 1. I mean, only 16% rated it a 10. So most people do not think they overeat, and yet so many of them want to lose weight and think they're often dieting. 67%, this is huge, 67% said they are fast eaters. 23% moderate, only 10% are slow. This is huge. So this is something that I think I can really work on in the practice. I exercise regularly, 41% 1. So people aren't exercising. They need to include more movement in their daily lives. Interestingly, 79% of people are very fatigued, 8 to 10. I mean, they rated it really high. 65% of those people rated 10 out of 10 in fatigue. I was surprised at that number. I get that complaint a lot, but didn't realize it was that epidemic. Digestive problems were kind of a little bit more evenly distributed. Sick more often than normal, sort of evenly distributed. Depressed, again, sort of evenly distributed. But this was really fascinating. I worry a lot. 46% of people rated it a 10 out of 10. Oh my God. 70% said 9 or 10 in terms of worry and anxiety. That was huge. So that was very striking as well. So with these, with what I found, with the numbers that I found, there were some things that I decided would help me to, work a little bit more on with patients. One is that I feel it's very important that I need to teach people about the importance of the relaxation response and how it affects their bodies. Educating people that losing weight is more than just eating less and exercising more. Teaching people to relate their relationship with food and that it mirrors what's going on in their lives. People don't generally see the connection at this point. I need to teach people more to include healthy dietary fats in their diet, and obviously to eat slower. That's, again, a huge thing, and I find that patients feel it's very difficult to do. I need to teach people that exercise should be enjoyable movement that nourishes them, and it does not have to be that hard and masculine type of exercise. I'm noticing, and I was surprised that fatigue is such a huge issue for most people, and to see if I can relate it more to food, to see if it has to do with their timing of food, their macronutrient balance, their rhythm. That I'm going to explore more and see if that impacts people in another way. And lastly, teaching people how to go into a relaxation response. I feel like that will really help alleviate their anxiety and worry. It's interesting that people see their lives as sort of positive, and yet they worry so much. They're so fatigued, and they feel like they have so much weight that they need to lose. So, in summary, what I want to do is, what I wanted to do, number one, was to just explore the attitudes of this community, how my patient population in particular felt about food and nutrition and their lifestyle and their beliefs about their health. Secondly, I wanted to see if there were a couple of areas that were more, I could target more, in terms of making an impact that would be more useful. And lastly, I wanted people to just know that we're doing this work, that this body of work, this amazing body of work exists, that there are people working on this, that there's information, and that there are ways to work on your relationship with food to make people healthier. So thank you, Mark, for everything that you've done for us, and this training has been wonderful, and I hope to incorporate more and more of this into my practice.